First of all, I just want to say, if you can see on the bottom row, just the number of organisations who've been involved with the development of this programme right from the very early days, where Professor Griffiths and I worked on the Impact Psoriasis programme some 7 years ago now. Time flies, longer than that possibly. And of course, Helen McAteer, representing the Psoriasis Association, was a co-applicant on that original research. And the PsoWell programme has come out of that body of research. It was the final of the work streams where all the other evidence from the other work streams fed into this programme of training around dermatology practitioners. I've taken it a step further with moving to Cardiff, and so we are now in the process of trying to roll out this programme. And again, the Psoriasis Association has been instrumental in helping to fund some implementation of the PsoWell programme up and down dermatology services in the UK. So it's an ever-evolving programme, which I'm delighted that is taking shape. So we're going to focus today on living well with psoriasis. I'm going to pull on some of the PsoWell evidence that we've got and some of the PsoWell training methods, but it's not entirely a PsoWell training session. It's a little bit broader than that. So I've already said how wonderful these two people supporting me are. You no doubt will have had some input from them so far. So we're going to have a look at what healthy living means, and how we can start thinking about change and the need for change, and how involving your clinicians in the change process can actually support your coping. And then, all being well, we'll have 2 breakaway sessions that each of the 3 of us will lead around making the most of the consultation with your dermatology practitioner, your general practitioner, or your dermatology specialist nurse, whoever it is that you interact most often with. And then we'll finish up with talking about behaviour change and talking about how you as individuals can develop a goal and an action plan to make that goal effective. And we'll come back together and we'll have a look at what's worked well. So what do we mean by healthy living? I know it's very easy for all of us to feel a bit overwhelmed with the health advice that comes out from a range of different places. And sometimes, unless you're living the perfect life, it can make you feel a bit guilty that you're not doing the things you should do, or you're not doing things as well as you should be doing. And I think the sort of message from all of this is when you're living with a long-term condition, when you're living with psoriasis, which is a long-term condition, it places additional burden on you as an individual, and it's not that easy to be motivated towards healthy living. That it's something we aspire to and we work hard towards, but it's not easy. And hence you need support in order to live as healthy a life as you possibly can. We all do, not just people living with skin conditions. So why is it important that we embrace the idea of healthy living and behaviour change? Because we know that health and health behaviours, and I'll talk about what I mean about these in a moment, they impact on your psoriasis. Now, in terms of how your psoriasis might be presenting with symptoms, or whether it is or isn't well controlled at the moment, and your future health. So it really does matter that we live as healthy a life as possible. And the good news is that there are things that you can do with it that's within your possibility to improve your skin and joints. But of course, you have a choice. You have a choice whether you eat a healthy diet, or whether you drink alcohol, whether you continue smoking or not. And the important thing that we teach practitioners within the PsoWell programme is to respect people's choices. that, you know, people make choices for all sorts of reasons, and it's not our job to judge people. It's our job to help people make choices to make changes when they want to, because it's hard to make changes. It actually needs commitment from people. There's a lot of confusing messages about healthy living out there. And so we need not to set people up to fail. We need to set people up to make small changes that they can see are impacting positively and to build on that. But for you living with a skin condition, you might need to take the initiative to ask your healthcare professional for support to make changes. So just coming back to the PsoWell program and the original impact research, we knew that there were some aspects of lifestyle, as it's called. It's not always lifestyle, it's not always a choice that people make, but aspects of how people live their lives can impact on inflammatory conditions. We knew that from the existing literature, and we know that psoriatic arthritis, psoriasis, inflammatory bowel disease, Crohn's disease, and so on, are all impacted by some aspects of living, particularly smoking, being overweight, being inactive, excessively using alcohol, and not sleeping very well, and experiencing high levels of distress. We already knew that. What the impact findings added to that knowledge was that, yes, we found these links with future unhealthy lives, such as cardiovascular disease and diabetes in the future for some people, not for everyone. But what we also identified, excuse me, was that there were extremely high levels of distress in people living with psoriasis and psoriatic arthritis. What I mean by distress is lots of anxiety, particularly anxiety about their condition and anxiety sometimes about the medication that they were taking. But in practice, this was not often picked up, and it certainly wasn't being managed effectively. So we explored that in detail, and we found that staff were not confident about helping people to make behaviour changes. So that's where the PsoWell program for health professionals came about. What we mean by healthy living, I'm sure you all know this, is having enough sleep, being physically active, not smoking at all, having very little alcohol, or at least moderate levels of alcohol, eating a healthy diet, a balanced diet, and certainly low carbohydrate diets now are beginning to show a lot of effect in terms of reducing the inflammatory processes. But maintaining a healthy weight and staying lean is really important. And you can see the Live Well link for those of you who want to know a little bit more about that. But I'm sure we all know what it means to live a healthy life. I'd be surprised if anybody listening to this presentation doesn't know what that means. The NHS also talks about positive mental health, mental well-being. And what they advocate is that we stay connected with people, preferably face-to-face. And of course, the pandemic has scuppered that, hasn't it? And it was unfortunate that they encouraged people to be socially distanced. Actually, what they meant was physical distance between people, not social distance. It was so important that people stayed in touch with their families and their friends as best they could. But they also advocate being physically active because that impacts on our sense of well-being and mood. To learn a new skill, if at all possible, to keep our brains active, whether that's something as simple as doing Sudoku or puzzles of any sort, or whether it's actually learning a new language or learning to sew or learning to bake. It doesn't matter what it is, learning a new skill seems to keep us engaged and healthy. Being kind and giving to others and reflecting on that and feeling gratitude towards what you have in your life. Family members, whatever it is that you feel grateful for, to bring that to the forefront of your mind and recognize it. And this thing called being present, not dwelling on what's happened in the past, not worrying about what might happen in the future, but living in the present. So those are the two areas in which we talk about well-being. And this little diagram just shows you that there are two broad pathways that impact on your psoriasis, that make a psoriasis flare or make your psoriasis well controlled. That would be through the inflammatory pathways, which of course your doctor and your healthcare practitioners will take care of, but also the other pathway that you can influence, and that's what we call the behavioural pathway. And these are not completely separate, they interact, and they often interact through mood. So if your mood is very low, it will have an impact on how you live your life, and it will have a direct impact on the inflammatory processes in your body. So bear that as we go in mind as we go through this presentation, that what I'm talking about is a joined up system, not separate systems. When we talk about coping, there are two ways that we can identify how people cope living with an illness or cope with an event. They can either approach it head on, see it as a problem to be solved, and go out and find information or people who can help them to cope with it, or they can avoid it. And we talk about avoidance coping as being something that's not very helpful in the long term. If it's an acute event that you just don't have headspace to think about at the moment, avoidance coping can be shelved in the short term. But in the long term, it's not a helpful coping strategy. So what we try to do is to encourage people to use less avoidance coping, forgetting about it, burying your head in the sand and hoping it'll go away, and more approach coping, which is to see it as a project or to see it as a problem to be solved, and therefore knowing what resources you need to solve it. And this little diagram just shows you how everything is interactive, how everything interacts. This is what we call the cognitive behavior model. You might have heard it referred to as CBT, which is a therapy type that's often used. And right at the core of this, what we do, our actions, you can see is driven by how we feel, our emotions, and what we think, our cognitive processes. But of course, this also drives how our bodies work. Again, it's that joined up system. If we want to change what we do, our actions, then we have to change how we think about things and how we feel about things. That's the essence of the CBT approach. But the basis of all kinds of therapies, psychological therapies, starts with asking someone for help. You have to be open to the possibility of help. You have to be able to tell people how you feel. That sounds easy, but actually if you're distressed, it can be really hard to put your finger on exactly what it is you're feeling at any one time. You have to be prepared to commit to change because it takes a bit of energy. And sometimes when people's mood is low and their energy is low, committing to change can be difficult. And practicing, just like with any other skill in life, whether it's learning to bake, whether it's learning to play the piano, it doesn't matter what it is, you have to practice and you have to build it in to your everyday life. Another form of therapy that sits alongside CBT is something called ACT, which is acceptance and commitment therapy. And again, the key features of ACT, acceptance and commitment therapy, is being present, living in the moment. And there are lots of techniques that can be helpful to help you to do that. Relaxation training, which is based on physical breathing techniques, and mindfulness, which is trying not to control the way you think, but allowing your thought processes and accepting that thoughts will come into your head, stay for a short while, and then leave again. The other area is knowing what really matters to you, celebrating your values. If your family is the most important thing in your life, it's just recognizing that and playing to your strengths. If you're the pivot to all of those people's lives, celebrating that. It's about recognizing your thinking patterns, your processes, and recognizing that thought processes are also just habits, like getting up First thing in the morning, cleaning your teeth, coming down, having a cup of coffee. That's a habit that can be changed. In the same way, your thought processes can be changed too. The fourth area is choosing your focus, knowing that you can choose what to focus on with practice when you think, and not feeling that your thoughts are out of control, that they are controlling you. And then the final bit is acting in accordance with your positive values. So if your family is the most important thing to you, staying in touch with your family, making it a habit that you regularly see them or speak to them, you know, in remote circumstances via Zoom or whatever it is. But recognizing and celebrating your values is really important. Okay, so I've said all that, and I'll speed up a little bit because I know I'm taking up quite a bit of time with this introduction. But the key points that I want to get across in this first part is that if we change what we do, our habits, we change how we feel. And likewise, if we change how we feel, that gives us energy to be able to change how we do things, the habits, the things that we do on a regular basis. So just very quickly, I'm not going to go into this in any great detail, but the key features of behaviour change is what we call the combi model. Com being capability, the opportunity, the motivation, which drives behaviour. So again, if we want to change behaviour, we have to help people to develop the skills to be able to do that, increasing their capability. We have to help them and support their motivation. And we also have to get them to recognise when there are opportunities to change. And whatever we think about the pandemic, it has been an opportunity to change. And I know an awful lot of people, certainly in my little circle, my family, my friends, they've made changes that they didn't think were possible. Changes about where they work, changes about how often they take the car to the shops, little things like that. It has certainly increased our opportunities.